The next hypothesis category on our list that I want to talk to is contributing factors to the development and maintenance of the problem. And I asked you to reflect on this before today's presentation and think, can you consider any contributing factors? And it can either be a factor that led to the development of a patient's problem or something that contributed to maintaining their health problem longer than you would have expected it to occur. This is an essential area of clinical reasoning, both in your analysis, but also in our management. It's not sufficient to simply categorize the patient's problem, as we talked about in the last presentation. In other words, to identify possible sources of symptoms or pain mechanisms. We need to also think about why their problem developed in the first place, or why is their problem persisting. So we need to identify underlying causes or contributing factors to the onset and maintenance of the problem. And there's many different potential contributing factors, but I want you to just be able to conceptualize this important area of clinical judgment so that you incorporate it into your clinical reasoning analysis. So some of the examples of contributing factors are genetics, gender, age. There are many different examples of physical factors that can be contributing to the patient's development and maintenance of their problem. So for example, flexibility. Somebody that may have stiffness in a hip, and because their hip is stiff, it causes increased mobility in the lower segments of the lumbar spine, which causes increased strain on those tissues and eventually nociception and pain. So flexibility can be a contributing factor. Also strength and motor control. It's very common for patients who have poor proximal strength and control to ultimately have poor alignment when they're doing function, simply walking or running. And if that occurs, that can lead to increased stress on different peripheral joints. You can also have physical contributing factors around a patient's proprioception, their balance, and many others. Environmental factors can also contribute to the development and the maintenance of patients' problems. There can be physical environmental factors such as work ergonomics, and a classic example here is the patient's computer setup, but also sport field and equipment conditions are environmental factors that sometimes contribute to different sports people developing problems or maintaining a particular problem. And then, as well as the physical environment, there's the social environment. And these can include things such as the employer and the family support that the patient perceives they have and the influence that has on their pain and their behavior. Lifestyle factors are important to consider as possible contributions to the development and maintenance of problems. They are things such as sleep deficit, physical inactivity, so more sedentary individuals, unhealthy diet, and other health comorbidities. And psychological factors will always be a potential contributing factor. And these include beliefs, distress, coping strategies that we'll come back to later on. But for now, recognize these as potential factors contributing to a patient's problem. And with each of these factors, you can also think to yourself is how modifiable they are. Clearly, genetics, gender, age are not things that can be modified, but we know they do predispose some people to certain problems. Other factors, such as physical factors, fortunately, can be modified with physiotherapy interventions, at least to a certain extent. But then some factors are modifiable, but they're more challenging, such as some of the psychosocial issues that we'll talk to later. I'd like to give you an example of this just to help you understand the concept of contributing factors.